listening to the Oncology Nursing Podcast, where ONS Voices Talk Cancer, a resource from the Oncology Nursing Society. Through conversations with subject matter experts, we examine the important issues in oncology nursing, from new treatments to patient-centered research to advancements in clinical practice. Join us as we hear from nurses in all facets of oncology care, from benchside to bedside and everywhere in between. Welcome to the Oncology Nursing Podcast. Hello and welcome to the Oncology Nursing Podcast. I'm your host, Chris Purcell, and today we're joined by Erica Fischer-Cartlidge, 2019 ONS Congress Career Fair presenter, nurse leader of evidence-based practice and clinical nurse specialists at Memorial Sloan Kettering Cancer Center in New York City, to discuss why goal setting is important, how it can help you advance your nursing career, and successful strategies for effective goal setting in practice. Hey, thanks so much for joining me today, Erica.
Oh, thank you for having me, Chris. I'm so excited to be with you.
We appreciate you taking the time to join us. Just to get us started, why is it important for oncology nurses to set professional goals, and how would you define the act of goal setting as it pertains to nursing?
When I think about goal setting in our careers as nurses, especially as oncology nurses, the first thing I think about is that it's a really great way to prevent getting burned out. There is so much discussion right now about compassion fatigue and burnout in nursing, but in particular in oncology nurses because of the type of work we do. And we know there's just ample literature out there to show that the more engaged people are with themselves and with their careers, that the less likely they are to develop compassion fatigue and burnout. So just having goals and something to strive for and really being engaged instead of focusing just on the day-to-day of the work is a really great way to combat that. We also know that goal setting can really be so many things in nursing. It could be working towards a mastery of a new professional skill, becoming certified, moving up the clinical ladder, a promotion to a new role, or even moving into a new specialty. But for some nurses, it may be just getting up the courage and the ability to go back to school after a while, or writing their first abstract or getting published. So there's so many different ways it could look in nursing, but there's option.
Absolutely. Yeah. It's kind of multifaceted in the ways that it can really benefit nurses. So I think that you kind of really hit that great point there. And I'm curious, how do professional goals differ from something like maybe a New Year's resolution? What sets them apart?
Well, I think the biggest problem with a New Year's resolution is that it seldom includes a plan for how to accomplish it, right? A lot of people say they want to accomplish it, but there's no plan for what they're going to do. Goals really give a sense of purpose to the activities, and they make you accountable for an outcome. So certainly a very successful New Year's resolution is one that there's a plan for how someone's going to achieve it, but most people don't go that far when they set one.
Yeah, I think that's a really great point. I know, it's like, I plan to lose 10 pounds, but I don't really have any plan to do it. So it's,
Exactly.
That's a great idea of how to set them apart. There's a clear roadmap with goals, and we'll talk about that a bit more, I think. And so some people might think, why do goals matter? And what would you say to them?
Yeah, I think the process of defining your goals really helps you gain insight into what's truly important to you. And sometimes professionally, we can lose sight of that, particularly if you've really been in it a while or if you're really new to it. And as you achieve your goals, you boost your efficacy, which builds character. So, both individually, but if you work with people on a team, setting goals helps keep everyone on the team motivated, engaged. It increases satisfaction. And we know that the evidence shows those who learn new skills as part of professional development, whatever that skill may be, are more efficient and effective, and they're less likely to leave their job. We also know that people who really have goals tend to be more innovative in problem solving. And we certainly know this is a career where we're faced with new problems every day.
Right. Absolutely. Yeah. And it sounds like a lot of that, it ties kind of directly back into that whole idea of fighting against compassion fatigue and keeping a sense of, clear purpose and moving towards a goal, is so valuable to people and to a whole team too. So I think that's kind of an interesting idea to keep it in mind.
Exactly.
And so, what are the different types of goals that nurses should think about or should know about?
Sure. I think if I was going to bucket goals, I'd really bucket them into kind of two areas. They can be organization focused or they could be personal development focused. So something like an organization focused goal is really about defining what you and your group want to do to create value for your unit or your organization. So this might be something like our unit wants to improve a nursing sensitive indicator or patient satisfaction, or we want to improve discharge times. Within that unit goal, you might have an individual goal for how you personally are going to contribute to that, but it's really about a team or a collaborative approach to something. To grow as an individual, you would have a personal development goal. So using the example before, if we had an organization-focused goal to improve patient satisfaction, individually, I may want to lead a quality improvement initiative for the first time. And so I kind of take on that leadership piece to the group goal. But personally, when you set professional development goals, you want to think about the skills or the forms of expertise you want to strengthen, and then how are you going to gain those? And so a lot of times they cross over organization focused or personal development goals, but sometimes they really are very separate and unique.
Excellent. Yeah, I think those are some really great ways for nurses to kind of think about goals on a couple of different levels and how they kind of seem to intersect with each other too. And so, what role does timing play in developing goals, and how should nurses think about maybe short-term and long-term goals?
Yeah, so different goals have different time frames. Some goals you aim to achieve within 1 or 2 months, others maybe many months or even years. Often achieving short-term goals are the small wins that energize you and encourage you to work towards more ambitious long-term goals. And we'll talk about it, I'm sure, a little bit later, kind of when we talk about how to achieve a goal, but long-term goals are actually often made up of many small short-term goals. So like moving up the ladder, for the clinical ladder, for example, might be a long-term goal over a year. But if certification is a required step to do that, it may be a short-term goal that you focus on as part of a larger picture.
Excellent. Yeah, kind of thinking about it in terms of almost like stepping stones to get to that long-term goal. I think that's a great idea, that pathway through. And so how should nurses think about prioritizing their goals?
I think this is an area where I really drive people to be smart consumers. And so really thinking about the healthcare environment where it is right now. And there are a couple things that we know are prioritizing in just the healthcare environment. And if you can align anything you're working on, personal, organizational, professional, to the things that are important in healthcare right now, it's just easier to get it done. So when prioritizing goals, I would say ask which ones improve patient outcome, result in cost savings or revenue generation, lead to more efficient workflows, improve productivity. So what's the value benefit of you kind of working on that goal to both yourself, but to your organization? And so you want to focus on efforts that really have the opportunity to generate value or the biggest improvements, and be cautious when you're doing that not to be juggling too many things at the same time, because then the quality can really decrease. So an organization or a team that has too many conflicting goals really struggles to achieve the most important ones. And it's possible that we've all worked somewhere where that's the case, where there's just too ambitious and maybe we need to scale back what we're working on. And so we want to be careful even on an individual level. It's great to have multiple goals, but should some be in the parking lot while you're working on some of the more ambitious ones?
Right.
One way to prioritize them is to compare them side by side and really kind of grade them or rank them and look at what ones to focus on now versus what ones to focus on later. And then set aside things that aren't an immediate priority but are still valuable. So I like to always call them then like my wish list or my wait list. And so as one thing gets completed, I can kind of move something off the wish list.
Excellent. No, what a great idea. And I really like that you touched on some of those key areas that are important in healthcare now, and how, your goals might be able to intersect with those. And it sounds like that would lead to, institutional buy-in where, your manager or the administration is kind of on your side, seeing the value of that goal that you're seeking and the development that you're going for. And so I think that's a great idea.
Absolutely.
And so, what are some temptations to maybe avoid when prioritizing work efforts towards your goals? Any things to look out for there?
Yeah, I think there are a couple big things that I always caution people to be aware of. The first is neglecting your priorities that aren't related to the goal. So if you become overly focused on just reaching a specific goal, you may overlook issues or things that aren't related to the goal but are equally important in your work. So just having too much tunnel vision. Another thing is to really always be aware of engaging in unethical behavior. And while people immediately have this visceral response to think, I may never, it can and it does happen without people realizing it. So if you have a lot of competing priorities, too little time to accomplish them, you may be tempted to kind of cut corners or develop workarounds. And that could be as simple as tweaking or misrepresenting data to get a project to look more favorable. And so it's just something to always be aware of. The other thing that I encourage people to be careful of is overly relying on incentives and rewards. So most people find a sense of accomplishment in a job well done. They don't need a lot of bells and whistles to kind of treat them for doing a great job. And goals that rely too heavily on financial or other rewards can really take away from inner motivation. And it can erode morale if those incentives aren't really designed very carefully.
Right.
And then I think the last thing I would just mention is be careful to not focus only on the short term. So goals that only focus on short-term performance might be energizing at first, but they may not produce immediate returns. They could actually kind of damage people's ability or interest in really looking at some of those big long-term goals because they're just focused on kind of instant gratification and in short-term production of kind of whether they were able to accomplish it or not. So it's always better to kind of set a longer range goal with smaller milestones than to just be looking at short-term goals where you're going to get this instant kind of feedback.
Right. I think that's such a great idea. And, focusing, like you said, on the instant gratification seems really important so that there's that intrinsic long form change that hopefully happens or some development in that regard. And relying on incentives can sound great in the beginning, but then potentially have all these kind of downstream effects or these consequences that might not be readily available. So it's something to consider.
Absolutely. I also think it's important to remember that we're professionals as nurses. And as being professionals, sometimes the greatest reward are the intangible thing, and that it's not tit for tat. Like, I did this, so now give me something.
Right. Yeah. Kind of like that scorekeeping sort of thing. It's best to try and avoid that, I think. And yeah, I know a lot of nurses find such a reward and passion in their work too, that hopefully they keep that focus and keep that in mind. It kind of leads me into my next question too, is, what are maybe some best practices for when nurses are sitting down and writing their goals? Anything you'd want to share there?
It's a great question. And believe it or not, this is something that people can struggle with until they do it a few times. So it's definitely one of those practice makes perfect. Goals should always be challenging. They should be balanced. They should really be clearly defined. And you always want to make sure that they're written down because that helps you to visualize that goal. So I always encourage people to use index cards for things, for a variety of professional things, but to write their goal down because it's small, it's carryable, you can tape it to a computer screen, you can put it in your pocket, but it provides that very tangible representation of that goal that you're working on. Some people have heard the term stretch goals. That's because really a true goal should allow the individual to stretch outside their comfort zone and traditional skill set to accomplish it. But even if the goal is a stretch, it has to be realistic. So as you set challenging goals, you want to make sure there's a solid plan and resources for how to reach them. And when you're physically writing that goal, there's a format, and you want to write, and your goal should always be SMART. And that means it should be specific, it should be measurable, it should be attainable, it should be realistic, and it should be time bound. So specific meaning you don't want to say something vague like, I want to move to the next level at work. Well, what next level? Next level on the clinical ladder? Do you want a promotion? It should be measurable. So, well, how will you know that you've achieved the goal? It shouldn't be kind of nebulous whether you achieved a goal or not. It should be attainable. So is it really realistic? If a master's degree is required to get promoted and you have no interest or desire to go back to school, then that's probably not an attainable goal to have. Is it realistic? So is it something within your control that you can achieve that? And then time bound. So you really want to put a time frame. When do you want to achieve this by? Is it in a month? Is it in a year? It's so that you really hold yourself to when you're going to accomplish that.
Absolutely. Yeah. What great tips. And I know SMART goals are so valuable. And, you touch on that timing aspect. It probably helps to also be able to prioritize, as you're working through your goal, you have that time bound factor. You can think about how you want to get it done and set out that roadmap so that you can get it done by X date and not make it, a New Year's resolution, so to speak, where it's like, I eventually want to do these things and hopefully it'll happen.
Exactly.
It's all about that roadmap. And I think that's great. And so once a goal is written, what's the next step to maybe achieving that goal? How should nurses think about goals in terms of maybe tasks?
Yeah, that's exactly it. The next part of the process is taking a goal and breaking it into smaller tasks or pieces, or taking a long-term goal and breaking it into multiple short-term goals. So let's use an example, something straightforward like certification. You want to think of all the things that need to be accomplished in order to become certified. So that may be ensuring you have the funds to pay for the test, registering for the exam, making sure you have the required continuing education credits, making sure you have enough practice hours, studying, and then physically taking the test. So something that seems straightforward, right, as a single goal, certification, actually can be broken up into these multiple smaller tasks that you want to accomplish. And then each of those tasks has its own time frame, which is part of achieving the larger goal.
Absolutely.
So for some people, it may be a very short time frame for making sure they have the funds for the test. For someone else, that may be a longer stretch, depending on what their financial situation is. So each of those tasks is going to have its own time frame and enable you to kind of have the small wins as you achieve each of those different parts.
Absolutely.
Registering for the test may be a 20-minute act on the computer, but to be able to say, look, here's another part towards my bigger goal that I've accomplished is really continues that motivation because you have something else that you've been able to kind of check off as part of the process.
Yeah, how great to have a bit of a checklist or a to-do list that you can go through and slowly cross off those tasks so that you're moving towards that goal. And definitely a kind of an intrinsic feeling of accomplishment as you move towards, let's say, the certification or whatever the goal may be. Super important there. And I'm curious, what role then does feedback play in terms of nursing and developing goals? Anything you wanted to share there?
Yeah, I'm so glad you asked that, Chris, because I think sometimes we lose sight of the fact that nurses are actually bound by a professional code of ethics to regulate themselves through the process of peer review or giving feedback. And so participating at all levels is really expected. And that may be feedback on how you deliver patient care, but it's also can be feedback in the setting of working on a project or a goal. And so, despite how important it is, a lot of people, especially nurses, tend to avoid it. They get uncomfortable giving feedback. They're afraid that it means they're judging or criticizing. But in actuality, it's really just simply sharing observations about work.
Right.
And when we talk about working towards a goal, if you're in a silo working on that, then you're really not benefiting from all of the expertise, the knowledge of the people around you. And so being able to kind of have touch points where you're seeking feedback, where people are giving you feedback on the work, whether they think it's reasonable, is incredibly important. And so I always challenge nurses to think about, how many times have you been at work and a change has been implemented and no one kind of asked your opinion about that before it went into practice. And you automatically think, well, if it had been done this way, it would have been so much better. If they had put the computer there instead of here, this whole room would have functioned differently. We innately have a desire to want to give our feedback so that things work out the best way they can. And yet so infrequently do we solicit feedback for ourselves when we're the ones in the position to need it. And so it really is an incredibly important part of being able to successfully achieve a goal. And constructive feedback really highlights opportunities for improvement. And if we really kind of be aware of fears and misconceptions that the person giving the feedback and the person receiving the feedback can have, then it's a lot easier to kind of move away from the barriers and have a better chance at getting some really great verbal encouragement, but also opportunities for how you can better achieve your goal.
Definitely. I mean, it's such a valuable tool in this whole process. So I think that you really highlight some key elements of what role, feedback can play and how important it can be. And I'm curious, what tips do you have for receiving and implementing feedback that you would want to share with nurses that are listening? How can they go ahead and take that feedback and put it into their goals?
Sure. I think the most important thing is to really receive it openly and neutrally. It helps you really be respectful and preserve trust in the process. If you hear feedback and you immediately become defensive or jump on the person about what they're saying and try to overly explain yourself, their chances that they're going to be comfortable giving you feedback in the future is just low. So you want to just receive it and then demonstrate you're listening, make eye contact, use body language that says you're listening. It doesn't necessarily mean you're agreeing. It's just that you respect the effort that it takes to deliver the feedback and you're receiving it. Paraphrase what you heard. So things like, what I hear from you is this, or so you think this is the best way to kind of do this. It helps clarify your understanding. One of the things we naturally do is kind of change what we've heard in our mind. And so mirroring back what you've heard to make sure you really receive the information, how the person intended it is important. And then you want to separate fact from opinion. While opinions do matter, they don't carry the same weight as facts. And so before you're implementing something, you want to make sure that you've really been attentive to the fact-based suggestions and then really weigh the opinion ones in terms of their value.
Excellent. Yeah, I think those are some really great ideas, really great ways to kind of receive that feedback. And you're right, we immediately start to kind of interpret things as we hear them, and probably in that course of the conversation, repeating them back to the person delivering the feedback is helpful to make sure that there's no miscommunication, that everything's clear and clarified at that point. So what a good tactic to use as you're kind of receiving that feedback. So great idea. And how often do you feel like nurses should check in on their goals and reassess to make sure that they're on track? What's that process look like?
So you want to think about why we even review or check in on goals, right? And the purpose is to make sure we don't forget something important to us that we want to achieve. So for a short-term goal that's looking to be achieved in less than a month, you probably want to review that every day. For something where the time frame of the goal is a few months away, it may be weekly or every other week. You want to make sure that cadence you choose is frequent enough to always keep the goal at the forefront of your mind and not kind of slide back where other things become more important than it. The more frequently you review the goals, the more your commitment is enhanced, your original motivation is refreshed, and it helps avoid distractions from what you want to achieve. Having reviews at regular intervals for longer goals is also really important because they provide checkpoints to see how much progress has been achieved, what still needs to be accomplished, and then if your original goal or timeline is still appropriate or needs to be revised.
Excellent. Yeah, and my mind kind of immediately jumps back to when you were talking about putting those goals down on note cards and having them like easily referenced so that you can pull them out and take a look at them. So if you're doing it every day, you have it right in hand. Or if it's every other week, you know where to find those goals and you can reassess. And I think that's a great idea. And so I'm curious, how might effective goal setting influence one's career development? We talked a little bit about moving up the clinical ladder and things, but I wanted to see if you'd like to expand on that.
Sure. Yeah. Strong goal setting is really tightly related to advancement and success in one's career. And that's not unique to nursing. It doesn't have to mean a promotion or clinical ladder advancement at all. Not everyone aspires to do those things. But as nurses, we're lifelong learners. And the reality is healthcare is changing, and it's changing at a rapid pace, particularly in oncology. And so there's always new knowledge and skills that need to be obtained and mastered so that we can continue to provide safe, effective care to our patients. If you set goals and achieve them, you can gain those knowledge and those skills that you need to be the best nurse possible for your patients, as well as achieve other professional milestones that we mentioned earlier, if that's something that's of interest to you. But if you can't evolve as healthcare is evolving, then your career is not going to be able to continue or develop because you're not going to have the knowledge and skill sets to safely continue it.
Absolutely. Yeah, great points. I mean, so many different ways it can impact your career, not just about moving up or seeking the next level or the next promotion. It's staying up to date and current with practice and that ever evolving healthcare landscape and making sure that you're delivering, the best possible patient care. So I think that's a great idea. Just something to keep in mind. And so, are there any resources that you would like to share for people seeking a little more information on goal setting strategies?
Yeah, ONS has fantastic resources for goal setting. A lot of it originated to focus on nursing students, but those resources can really be applied to anyone. So, for example, there's a form that was created that's used to be a guide when a student nurse meets with a mentor. That's something that really anyone could use before a mentor meeting or when they're talking about their goal setting. Even if you just go to the ONS website and put in the search career plan, a number of resources and pages come up that really have robust information. And so being able to kind of sift through those and see what applies to what you're looking for. That form in particular and an article that was done for some nursing students that I think really have some great kind of core concepts. I think if it's okay, we could include those in the podcast notes for people. And in addition, I think I'd really recommend if your goal is focused around publishing or writing an abstract, use the formal mentor programs that are available through the Oncology Nursing Society and the Clinical Journal of Oncology Nursing, because those are really structured to provide a lot of support. And we know in the literature that mentors are a really great resource for anyone, regardless of the type of goal that you're working towards. Not only do they provide support and encouragement, but it's an external source to hold you accountable to.
Absolutely. Yeah. And we'll make sure to include those links in the podcast notes, like you mentioned, just so if anybody wants to go down and check them out, they'll be right there. And so, Erica, just to wrap up today, do you have any final comments about goal setting? It's important to successful nursing or anything we might have missed today?
I think I just want people to know that it can seem overwhelming sometimes to have a big goal or set a professional goal for the first time in a long time. But remember just to break it down into small pieces and make it more manageable. Innately, everyone has the skill set to do this. I want you to think about really how often we make informal goals in our personal lives. It could be getting up on a Saturday morning and thinking about everything you want to achieve around the house that day. That's goal setting. It's just in an informal fashion. We do the same thing. We think, I want to clean the house. And what does that look like? Well, I need to vacuum. I need to do the laundry. And, whatever that may be, I need to cut the lawn. And so you're taking a larger skill, you're breaking it down into tasks. You have these skills, you're doing them all the time. It's just about changing them over into the professional realm, which is something people may not have done in a while, or it may be something you do all the time, but you have the skills and you can do it. Don't be afraid to share goals with those around you. It wasn't a secret when you went to nursing school. And so your goals once you're a nurse shouldn't be a secret. The reason you're able to be successful is because the people around you can help lift you up and support you when you're feeling nervous or feeling frustrated in a goal. Don't keep your goals a secret, and look for mentors and people to help you along the way. They may be the most unlikely of people, but they're somebody that has a skill set and really is able to kind of help you propel yourself forward.
Excellent. Yeah. I mean, some really great takeaways to leave us with today. And you're right. That kind of camaraderie that you brought up right there, I think is such a great point that, not only are you able to have your community help kind of hold you up, your nursing community hold you up as you go about seeking your goals, you can do the same for your colleagues. And that's so important. And yeah. So I can't thank you enough, Erica, honestly, for sharing all these helpful tips today. It's been a fascinating conversation. I hope maybe someday you'll come back again and join us and we can chat some more about career development and how successful goals can be.
Oh, I would be happy to. Thank you so much for having me.
Absolutely. Thanks so much, Erica. Thank you for listening to the Oncology Nursing Podcast. Tell us about your favorite part of this episode by leaving a review on iTunes or wherever you download your podcasts. For more resources and information about oncology nursing, visit us at ons.org or voice.ons.org.